dull Brown's legacy. Stay-at-home orders, coupled with the fear of exposure to COVID-19, seemingly kept many people confined at home, and also out of the arms of unknown partners throughout the pandemic. The pandemic hampered testing efforts for diseases such as chlamydia, gonorrhea, and syphilis during the past 2 years. Testing is a critical part of controlling the spread of these infections, in part because both chlamydia and gonorrhea can initially appear without any symptoms. Between 2015 and 2019, documented cases of all three diseases had increased by 30%. Then, from 2019 to 2020, Centers for Disease Control and Prevention data suggested that chlamydia cases dropped by 14%, while cases of primary and secondary stages of syphilis experienced a modest decline of 0.9%. But later, the experts revealed this dip was not real, and that cases simply fell because they weren't testing. Casey Pinto, an assistant professor of public health at Pennsylvania State University, led a May 2020 study. She showed that as COVID-19 case rates increased across the country, the number of tests administered for sexually transmitted infections fell dramatically. In April 2020 in New York, for example, the rate of people testing for COVID-19 soared to more than 25%, while sexually transmitted infection testing rates dropped by more than 75%. Amid the crush of the pandemic, many clinics across the country also prioritized symptomatic patients. The uncertainty in the numbers is especially worrying because it can contribute to unknowing spread. Gonorrhea is asymptomatic for most women who get it. Chlamydia, which is the most frequently reported bacterial STD in the US, is asymptomatic for up to 50% of men and 80% of women. A burning sensation while urinating is a common symptom for both infections, but without the proper test, it can lead to a misdiagnosis of a urinary tract infection. In the earliest months of the pandemic, many clinics that routinely screened for STDs shut down. Their staff was diverted to help with coronavirus testing and contact tracing. By May 2020, the National Coalition of STD Directors reported that 83% of STD programs in the US were deferring services, and that 66% had experienced a decrease in testing. By August 2020, it reported 1 in 5 STD programs was completely disrupted. Another challenge that the clinics faced was a shortage of tests. In a survey of STD health departments, the CDC reports that 51% of respondents lacked gonorrhea and chlamydia tests in April 2020. The CDC collected additional survey responses to January 2021, by which time 38% said they didn't have enough tests. Labs that run the test results were also diverted to work on COVID-19, swapping routine STI tests for the PCR and antigen tests that detect the coronavirus. Every year, the UAB STD Diagnostics Laboratory runs approximately 20,000 STI tests. However, in 2020, the lab doubled its volume of work but did zero STI testing. Today, clinics and labs are crawling back toward their pre-pandemic testing practices, and many, if not most, are resuming routine testing, and some are once again welcoming walk-in patients. However, many experts worry the damage has already been done. A study found that it's likely more than 150,000 STI cases were missed through July 2020 alone. Whitman Walker reports that its chlamydia and gonorrhea rate sat at 11.7% in 2019, and by November 2021, the rate had already reached 11.2%. This is likely an underestimate, with testing still hovering at 80% of its pre-pandemic capacity. The numbers are more dramatic for syphilis, which went from 14.2% in 2019 to 16.5% in 2020. At the Los Angeles LGBT Center, which provides STD and HIV testing, epidemiologist Nicole Cunningham says that after an initial dip in cases of each of the infections for which it tests, the center is now seeing spikes across the board. By June 2021, the center was testing as often as it had in 2019. And between June and October, cumulative gonorrhea cases increased by 23.8% compared to the same time period in 2019, Cunningham says. But because of the pandemic's effects, true increases are tough to identify. Now, a question that must be asked is that are increased numbers a catch-up of sorts, the result of running a backlog of tests that would have, under normal circumstances, been processed in 2020? Or do these increases represent true prevalence and uptick in actual disease spread? Only time will tell. And with that, it's time for us to call it a day. We do a lot of research to come up with informative videos like these. If you think we deserve the love, hit the subscribe button and click the bell icon while you're at it. Also, tell us what topics you want us to cover next, because your valuable suggestions are always welcomed in our comment section. And I'll see you in the next video. Have a great day.